Hi, everybody. My name is Dr. Duarte Erin. I've been in practice in Ventura, California, about 18 years. I joined the practice. It was a well-established kind of legacy practice for 45 years now. Two partners and then myself. And so we have two locations, three associates. Um, and it's a busy practice, but I would say overall it's been a great run and 18 plus years. So I'm really happy to be here to share some of the things I've learned along the way. I have associates. I've been an associate, and so maybe I can answer some questions and give you some tips along the way. My little bit of a background: I live in Santa Barbara. I work in Ventura. I have two kids, 18-year-old boy and a 15-year-old girl. That's a picture of my staff. That's a very old picture. We need to update it. But we have about 13 staff now and three more doctors. So yeah, it's a great practice. I love it a lot. And I think Jake and I have a lot of similarities, but a lot of things we do a little bit differently too. So I think we can give you a pretty good session here tonight, and hopefully you get a lot out of it.
Awesome. Well, thanks, Erin. One thing I wanted to mention, I'll go back to Erin's slide. So you can see the little QR codes down here. So if you want, I'll leave her slide up for just a second. You can take a screenshot or scan that. One thing I wanted to say before I get into it is we're really, I mean, this format, it's a little bit challenging to kind of have a, back and forth interaction. We will answer some questions at the end and try and kind of get everything wrapped up there. But if you have any questions that aren't answered, or you think of stuff along the way, or next year, or next month, or whenever, feel free. I'll go to my kind of QR code there. Feel free to reach out. We kind of talked about, what's the best way to do this. And I think just a message on Instagram would be best. That way we know who you are, you know who we are, and we can kind of do some communication back and forth and answer any questions you might have as you work throughout your journey as a resident and then beyond. Um, so this is kind of a smorgasbord of a lot of different stuff. I'm from Utah, born and raised in Utah. I attended Southern Utah University. I got my bachelor's degree in Spanish many years ago. Decided to go to dental school and went to the University of Puerto Rico. So it kind of worked with my Spanish background and my desire to learn Spanish and get better. So I spent 2009 to 2013 in Puerto Rico. And I practiced general dentistry for 3 years. And it was a great experience. I loved it. I don't miss it at all. I'm really glad I'm an endodontist, but it gave me kind of a good foundation for where I am today. I was in a private practice for about a year, and then I did community health for a couple of years. So I've kind of tried a lot of different things and eventually made my way to Michigan, University of Detroit Mercy, where I finished my residency in 2018. So I don't have a list of those residents or where you're from. So there may be some Detroit Mercy folks out there. I may even know some of you that are on the call. So really looking forward to sharing a few of my thoughts and things that I've learned along the way, and also kind of connecting. Next week, Erin and I will be there at AAE. I'm sure many of you, if not all of you, will be there as well. So we'll be hanging out at the Avalon booth here and there. You'll probably see us at the classes and the events. So come say hi, introduce yourselves, and it'll be great to make that connection. This is my family. I have four kids. My wife, Heather, and our four kids. My oldest is 16. The youngest and oldest are boys, 16 and 9. And then I've got two girls in the middle that are 11 and 13. I just kind of put this picture up of the bottom. I'm from the country, so Wichita, it's got kind of a little bit of a country feel, a little bit of a city feel to it, but it doesn't take long to get outside of the city. And so we like to get out of the city every chance we can. So we like to ride four-wheelers and dirt bikes and side-by-sides and just kind of be out in the country doing country stuff. So when the poll was sent out, so the Avalon folks sent out a poll that basically asked you kind of what your interests are. I mean, it would be easy for Erin and I just to talk about the things that we want to talk about, but really we feel like this will be most beneficial for you if we kind of answer some of your questions. We may not cover everything, and again, in the chat, you can answer additional questions that aren't answered. But really, kind of two broad categories of questions came up. One is, what do I do next? What am I going to do after residency? You may already know, you may have a few options that you're considering, or it may be something where you're just like, I'm a first year resident, I have no idea yet. And so we want to talk a little bit about what we did, what we've done, how our plans have changed over the years, and those types of things. There's so many options out there. There's so many wonderful options. I think you should be really, really excited about our specialty and the trajectory of your careers. It's an awesome place to be. It's an awesome group. It's a tight-knit group. And the bottom line is you can be successful in any type of practice that you choose. There's really the sky's the limit, and that's not an exaggeration. The other big thing was, how many cases can I do? How much money am I going to make because of how many cases I can do? And so we kind of broke it down into a few subsections: technology, utilizing our staff to help us do the highest number of cases we can per day, what types of files and materials there are that make our job easier, that make the cases quicker, that make them more predictable and more successful, and those types of things. And then also, kind of to wrap things up, mentorship, the skills that we learn along the way, and things like that. So we'll just kind of jump into some practice options. I'll kind of bounce it over to Erin. I'll let you kind of explain to the residents what you did, how your practice started out, and kind of where you are now.
Sure. So, like I said, I joined a private practice 18 years ago. It was one of those back in the day where you actually had to write a resume and like mail it out. So I just looked up all the places I wanted to, where I wanted to be, and I wanted to be in Southern California, and I sent out resumes, and I got a couple of calls and some interests, and I was interviewing them as much as they were kind of interviewing me. And I landed in a practice where there were two partners. One was kind of older and one was older than me, but still going to be there for a little while. So I kind of liked that idea that nobody was going to retire in a couple of years and I would be, on my own. I wanted to be in a place where I had a mentor and I had the ability to be part of a practice together. So it was purposeful associateship. So the point to this one wasn't just an associateship. It was, you will associate. And then in 3 years, we all sit down and agree that you'll partner. So they didn't want to forever associate. They wanted someone who was going to partner eventually. And I liked that because that was my goal, to own the practice as well. So for me, that felt like a right good fit. I liked the community. I liked the town. I certainly felt like they were interested in mentoring me and spending time with me with my cases. And it was an amazing experience. I think personally, it takes about 3 to 5 years after you get out to really feel comfortable in your own kind of endo skin personally, from my experience and what I've seen from my associates that come out of school and work. So I think that goes more smoothly and more quickly, and certainly in a way that makes you feel more supported if you're in a space where you have a mentor. And in this day and age, it doesn't have to be a mentor that, like I did, where they were physically there with me. It could be, Jake and I were talking about how now it can be, people you follow online or people you meet, at these meetings. And you just really want to try to find a way to create a situation where you're not alone, in my opinion, right out of school. I think that would be really tough to do. So I associated for 3 years, then I became partner, and we've started to take on partners as we've gotten bigger, or associates. And then one wanted to partner. So we've even done the transition into that. And I would say, again, it just took a while for a lot of them to feel really comfortable. It's amazing what you don't know coming out of school. You just don't know all the things you're going to see and come in contact with, and the help you can get from that. Working in a group practice has really been great. And I think like I said, I think you can get better a little bit faster. I think the other advantage of being kind of an associateship partnership in a private practice or a group practice of some kind is just that there's, a bigger chance for a better referral base. I mean, nobody's going to love not everybody's going to love you, but they may all want to refer to your practice because they'll like somebody in your practice. They may want to send to a woman. They may like, the one of my partners was an older military guy, and so he had a certain way about things. And so I think you can pull more from your referral base if it's not just you. One of my partners started a basketball league, and the other one played golf. I did a women's cocktail party because that's what I'm good at, but so we started to get all these, referrals, and then everybody sees the patients here and there. So I think just from a standpoint of marketing and referrals and making money, you actually make more together, in my opinion, than you do alone. At least that's been it for me. And then, on the hand of I don't have to worry when I'm gone. So when you take vacations, you have to think, who's going to take care of my emergencies? Somebody's filling is going to come out, somebody's going to abscess, somebody's going to get swollen, and they get to come to my practice. They know where I am. They know the front office. They just see my partner. The chart is already there. It's kind of a cohesive thing when you leave town, that you don't have when you're on solo practice. I think you have to
Yeah.
call somebody and
That,
say,
I
hey,
mean,
you
that
cover for
alone,
me.
that's a huge benefit. And this is something that you and I mean, I was on vacation last week. You've got vacation coming up towards
Right.
this week. And I was gone. I didn't hear one thing from the practice. It's not
No,
because
but they probably saw one or two of
it's
your patients,
because
right? And the
my
occlusal
team, my
adjustment.
guys took care of it.
Yeah.
Yeah.
And so I think that, things like that maybe I wasn't even considering when I was coming out. I just wanted to mentor. I just wanted to feel supported. But now I see all that, benefits of not being and making decisions of who to hire and who to fire and what insurances to take. You're just not alone. And especially like I said, I was really lucky. Mine had been around for a long time. He'd been practicing for 20 years already. It was a well-run machine. And that's the other thing Jake and I were talking about. We have kind of a different way we run our offices, and really is because that's how we came into the office.
Yeah.
It was that way, and that is the way it has stayed. My staff has certain roles they play, and you have to decide when you get there, is this a good fit for me? Do I like the way this place is run and how it's running? Because it's probably not going to change a whole lot once you're there. You need to be a part of it, of course, but so things like that I think are important to look at when you're looking for what are you going to do after school. It's not just about how busy is the practice, because you can always make it busy. You can get there, but I think it's also about finding, because you're married to these people almost, so it's a marriage, and you have to get along with them and the staff and how it's run, how they do their marketing. So I always really try to sit my associates down and tell them that, this is a very patient centric office. If you're here to clock in and clock out and not do any marketing and not give them this like super fantastic internal marketing moment while they're here, this probably isn't the right fit for you. And I don't know, Jake, if you guys have that same conversations with your associates when,
Yeah. Yeah. I
you
mean, and
interview on both sides.
kind of another big thing too is when you're choosing where to go, like I think it's important to decide, like for you, Erin, you talked about you knew you wanted to be in California, or at least that's kind of where you were looking. I
Right.
did things a little bit differently. I was looking more for, I can guarantee you, I wasn't looking to go to Kansas. That was not even on my radar.
I love that story. You should tell yours now. It's a good one.
Yeah, and so I was looking more for, I kind of ranked things, and location was important in the sense that I needed a place where I could raise kids and be safe and have stuff to do and things like that. But it wasn't like I need to go back to Utah, or I need to be in California, or I need the beach, or I need the mountains, or anything like that. I ranked like opportunity first, like opportunity and mentorship. Those were high on my list. And
Yeah.
so I was actually at AAE. Maybe some of you are first year residents. So it was AAE my first year. It was 2017, I guess, in New Orleans. I went to the career fair, which we're going to have next week. And I just started talking with people, talking with people, talking with people. A lot of folks told me, come back next year when you're getting closer to graduation. A few said, "Oh, let's talk about some options. It's never too early." I found a great opportunity in Wichita, and again with mentorship, that was the big thing. I liked the guys that were there. I liked their philosophy. I visited the practice, and I liked the way that they did things, and I could see potential there. And so, I came thinking, okay, I'll give it 3 years, and that was almost 7 years ago. And again, it's not because Wichita is the most exotic place because it's not. I mean, the weather is extreme. There's no mountains. There aren't really that many Great Lakes or anything like that, but it's a really great fit for me and my family. And so I think you'll find that as well.
I think that's really smart by you though, to not put the boundaries so much on location because it really opens up a lot of opportunities and a lot of great places like you found. I mean, your practice is fantastic. It's in Wichita, Kansas, but you've kind of fallen in love with Wichita,
Yeah,
Kansas.
yeah,
You like
it's
it.
been good. It's part
So
of it
I
now.
just think that's really smart. So keep an open mind to the opportunities that are coming. And I think we both agree having a mentor, having a place where you really feel like you can grow and be an excellent endodontist is probably maybe should be higher on your list than some other things.
Yeah, for sure. And similar to you, so I mean our practices they were kind of similar but kind of different. So I joined in 2018 as an associate, hoping to do, we kind of had a deal where after a few years we could do a partnership if everyone was still on board and I was sticking around and that type of thing. And a lot of you had brought up, and I'm sure this is on your mind because you're getting bombarded with advertisements and parties and things like that from the DSOs, the ESOs, and you'll see them all over at AAE. And so after a few years, we ended up doing a partnership with, at the time it was Endo One Partners, now Specialty One Partners. So just to let you know, and Erin has also been part of the same organization. So we wanted you to know that. You'll probably see us at their booth at AAE here and there. You'll see us interacting with them. You'll see it's at the resident party. Again, come by, say hi. Absolutely no pressure. We're not trying to get you to join or saying that we're the best or anything like that. But it's been awesome for us. And we're like what, 5 years in almost,
Yeah.
Erin?
I
About
would
five
say we
years
are the
in.
best. I would say come to the party. I love it. I don't know. It was a really
Yeah,
good decision for where I was at that time.
yeah,
It
for
was
sure.
it was
So,
a great decision. So please
and
come
if
see
you,
and check out all your opportunities. And this
yeah,
goes back to where they have so many places, not just Specialty One, but you can work anywhere you want if you join kind of and you're joined. Like I have associates that work with me now and they're part of Specialty One, but really they work in my office just like Jake's and they get that personal touch, that mentorship. It's not a I don't know, doc in a box kind of clinic. It's Ventura Endodontics. Um, but it is part of Specialty One now. We are partners. And
yeah.
I
As
think
far
it's
as the startup option, we don't have experience in that, so we can't really speak to that. But I don't think
sounds
it's,
hard, is all I'm
yeah,
going to say. That sounds really hard.
definitely hard. Yeah, for sure,
It's
because you
hard
kind of
enough to
miss
be in
out.
it.
Yeah. I think Allison, are there any questions on the practice options before we move on? Because we're going to totally shift
Yeah.
gears. I know we talked about doing questions at the end, but I just
No,
wanted to
I'm
make
fine.
sure that we wrap things up here.
I
In case there's
don't see any questions as of yet.
Okay, very good. So the next thing we'll kind of jump into number of cases per day, how to be efficient, how to make money, how to pay off student loans, how to go on vacation and buy the house and buy the car, whatever it is you want to do with life. Let's talk about technology, I think, Erin, to start out. I think you should go ahead and run with that. We use a lot of the same technology, so we can kind of bounce
right.
back and forth on what we're doing, what we're using for technology, and kind of go from there.
Okay, great. So technology wise, and I bet all of you are using this as well. I mean, who doesn't do endo without a microscope? It's a must. You have to use your microscope. It will make you faster. It'll make you more efficient. So I can't believe I'm speaking to anyone who doesn't use one. So I'll kind of move through that quickly. Doesn't matter what microscope it is. I like my Zeiss. I can take photos through it. I document with my microscope. I use my technology, not just for the microscope, at least not just for seeing, but for also documenting cases, putting it in a really pretty 8x10 glossy. Again, this is just marketing. It's just making you look better and smarter. And it's patient education. I show them later too. So I think the microscope has value in multiple ways, but you all know that. CBCT, I also wouldn't do root canals without them anymore. I take them on all my cases. They will make your diagnosis faster, easier. You can explain to your patients so much more quickly and efficiently, which will make you faster at the end, what is happening and what they need. You show them a two-dimensional x-ray. It's very hard for patients to understand. And it's really important in a private practice where you want to do well and be well respected that you sit there for just a hot minute and you're going to explain to this patient what you see, what is going on, and what they need. And it's so much easier on a CT scan. They can see the giant black hole and they can
Yeah,
orient themselves a little easier. So I
for
think the
sure.
CT scan has, right? You use it for the same
And kind of another thing
education.
too that I didn't realize would be so beneficial, and this is kind of like looking at it from the other side, but it helps you know when to not do a case,
For
which
sure.
which is huge.
Yes.
There's nothing worse than getting in a case and thinking, "Oh, why did I do this? This
Right.
isn't
Now
going to
there's this
work. I've wasted
giant
an hour
internal
of my
resorption.
day."
Yes.
Yeah, the patient's
Great.
unhappy. Now I'm going to charge him an inoperable root canal fee for my time, and it's so great to be able
Yeah.
to sit down with the patient. It's a teaching tool, really.
Yep.
And this is one of the things that I love about endo. You don't have to sell the treatment.
Yes. Exactly.
So you can sit
Nothing.
down with the patient, you pull it up on the screen. This is what I'm seeing. This pattern of bone loss is indicating this. This is why I'm recommending a root canal. Do you want to
Exactly.
do it? And they're like, oh,
Exactly.
yeah, of course. I see the dark spot. I see the bone loss.
Yes.
I see the sinus is full. I see that it's not working as intended from the previous treatment and all of these things. So
Right.
I
It just
also
takes a few
take,
minutes. I mean, it doesn't take much
yeah.
time at all. And it just adds so much value to you and their respect for you. Now they're all in. You can explain it. You're so smart and they trust you. And now they trust that they need it. I mean, like Jake said, it's such a tool in a way you don't really think about when you're using it just for diagnostics.
And then one question that I've gotten quite often from residents, new practicing endodontists, general dentists is, how do you know which case to use it on? I'm like you, I use it on every case, but
Every-
root canals are complicated. All of them are complicated. Anteriors are complicated, incisors, canines. There's always something you can gain from looking at the tooth in three dimensions, the supporting
Yes.
structure. And
Yes.
so I would suggest, I mean, in residency, we didn't use them that often. I mean, it wasn't that long ago. We had access to it, but it was a little bit, it was tough. It slowed the case down. We had to get it read by a radiologist. So there were kind
Oh
of
my
like a lot of things involved there that kind of made me not want to utilize it very often. But again, the mentor that I had when I joined the practice said, let's take it on every case, and I'm going to show you why. And the things that Erin mentioned, and it's been extremely valuable for sure.
And I would say if you're hesitant about it because you don't feel comfortable reading the CT scan, it's really not hard. Just sit down with someone, take a class or two. I mean, call me, call Jake, somebody, but it really is something you could learn. And as you take more and more, you'd be amazed how quickly you get good at reading CT scans. So don't let that stop you. That's an easy fix.
Yeah.
Um,
What
yeah.
about advanced irrigation? I know you've used a few different products. What do you like? What do you love? What do you hate?
So I drank the Kool-Aid on the Gentle Wave. Did you ever use Gentle Wave? Did you guys have that?
Only in residency, never in
Okay.
practice,
Oh,
and
good for you.
only in a they brought it in and we used it on, a
Yeah.
handful of cases over a couple days.
Yeah, it's not the easiest thing to use. It takes a little bit of extra time. There can be a lot of messiness with patients tasting bleach and getting it in their sinuses. But at the end of the day, you really do know that this was an advanced irrigation technique that was significantly cleaner than you were going to do any other way. So for me, it was, I just felt it was necessary in order to do good endo. You had to have a microscope, you got to have a CT scan and some kind of advanced irrigation. And thank you, Jake. Last year, Jake introduced me to lasers and I am madly in love with them. I threw out my good dental waves. Well, they broke, but I didn't want to fix them. So we got a ton of lasers and I think they do a great job. And they are, again, don't let it scare you. It is so user friendly. I don't know if they're doing that in residencies right now. Do you know if they're using them?
I think they are. I mean,
I
I
would
know
hope
they
so. That
see
would be
the
smart by the
programs.
companies.
Yeah, hopefully you're using them. Hopefully, if not, you at AAE get in touch with the reps. There's a number of
Yes.
companies. I've only really used the Edge Pro laser, and so that's the one I can speak on. But again, visually, it looks cleaner. It makes my cases easier. It's easier to get
Yes.
to working length.
Yes.
I see debris flushed out of the canal when I think I'm done, doing the traditional way of doing root canals. I'm getting, lateral anatomy and apical fireworks and all these things that you like to see and post on Instagram and those types of things. It pairs really well with some of the Avalon products, especially the sealer that we're going to talk about a little bit later. kind of pairs with the laser. And so, yeah, I would say utilize this time in residency to try these things, try the different brands,
Yes.
try the different products, get them into your programs, talk to your directors if you're not utilizing them. Hopefully, I know there are some programs. Let's see, Dr. Barnett, is he at Penn?
Yeah, he's at
Uh,
Einstein.
Einstein, okay, yeah, and he's like he's great, and he
Awesome.
uses everything,
Yes.
and he teaches the residents. So maybe some of you are there, but yeah, look for opportunities to utilize these advanced irrigation techniques and see what fits, see what feels right.
And again, I think, don't you, I mean, you use the GenWave a little bit. The GenWave was usually just once and then you stop using it. You never wanted to try to use it twice because it's just such a pain in the butt. But don't you use
Yeah,
the laser? I sometimes use it in the beginning. I'll use it in the
yeah,
middle. I'll use it in the end. I'll only use it at the end. It's just one of those so quick and easy. And it, like he said, it gets you to work. Like if anything's in your way, laser for 30 seconds and boom, you are done. You are good. It's fantastic. And then, like he said, you'll see junk. Like you could do it in an abscess and just chunks of pus and exudate just starts floating up to the top. I mean, it's very satisfying, and it's just a superior way to clean these teeth and makes me more confident in single visit endo. So if we're talking about cases per day, making a lot of money, which, comes with excellent endo. So just when you become good at what you do, you will make a lot of money. But I didn't feel confident. I don't know about you, Jake, but without it, I wouldn't feel as comfortable doing single visits on a lot of my cases.
yeah, same way. And now with the laser, I mean,
Yeah.
almost every single case gets one visit.
Yeah.
I'm
Me
that
too.
confident in it. Yeah.
Yeah.
And so yeah, I mean, total game changer, practice builder.
Yeah.
It doesn't slow down your workflow. I don't do fewer cases per day. The referring dentists love it because they're getting the patients back quicker. I mean, this is anecdotal, but I feel like we're getting fewer complaints of like post-op pain and flare-ups and things like that. Again,
Yeah.
I haven't like tracked it or anything, but it seems like that's the case.
Yeah.
Maybe some of you guys can study that if you're working on a master's or a thesis or something like that.
Right.
That would be, I think that would be really pertinent and really awesome.
Yeah.
Um,
Yeah.
and the
So
patients love it. I mean, the patients like for whatever reason, you're like, I'm gonna use this laser in your tooth, and they're like, yes, a laser, and
yes.
you can hear it boom, 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 boom. You can hear it firing and this energy, and you probably get some sort of a placebo effect, like, okay, this tooth's gonna heal. Especially on retreatments, I use this all the time to say, even retreating my own cases from before I had the laser, I'll say, I already did this once. It didn't work as intended or only worked for a few years. I've got this laser now. I think it's going to give us a little bit of an upper hand. You're going to hear it. It's loud. It's going to flush and touch areas that I couldn't get last time. And for whatever reason, that tooth that was slightly sensitive, I mean, it's getting cleaner, but I feel like the mental part of that is
Can't
helping
hurt.
the patient feel
Yeah.
better.
The power of positivity there.
Yeah, yeah, for sure.
Yeah. I couldn't agree more. I think it doesn't slow you down. I think there's no sales to it. Again, endo, you don't have to sell anything, right? You can show them the CT scan. They're going to see the value as soon as you explain things to them. My patients are always like, wow, you can see how this is great. And so I charge for it. I charge for the scan. I charge for my laser. So you make a little more money. But it really just comes down to the fact that you're doing a better job too. And I have no patients are ever like, no, thank you.
Yeah,
So
yeah,
there's no sales to it, and that's so that shouldn't stop you either. But you don't have to charge for it. You could just include it all in your fees or something. I'm just
yeah.
like Jake said, it just doesn't seem to get a lot of pushback, and patients are excited for it.
Absolutely. One way that we've been able to really utilize technology, especially the CBCT and the advanced irrigation, is by just this will kind of go into our next topic, the staff optimization. We do things a little bit differently. I lean on the staff just because of the way my mentor did things. Like I have my assistants do like everything but the numbing and the root canal, basically. I know you're a little bit different. There's no right or
Which is
wrong way of
brilliant.
doing things.
Yeah.
Yeah, I have just a picture here. We have a leadership team, and so we kind of have a hierarchy of leadership, and they do the hiring and the training of the new assistants, and when there's a problem, they're dealing with a lot of that, so I can focus on doing root canals. Here in the center, we got our Chiefs gear on because we've had kind of a nice run, with the exception of this year. We lost in the Super Bowl, but kind of had a nice run here in Kansas and Missouri, of course, Kansas City. And so my two assistants, Marisol and Sam, they're awesome. They're wonderful. They make me a lot of money. They're responsible. They have kind of like the way we have it set up is they each have their own operatory, and I'm bouncing back and forth between the both of them, and they just kind of stay in the one, and they're working up the patient and going over, they're doing the pulp vitality testing, they're placing rubber dam, they're removing rubber dam. They come in my office, they load the CT scan, they read the scan, they line it up, they measure the estimated working length. They're doing really, it's almost like having another doctor there, like walking me through things before I've even looked at the case. So it's like, here you go, doc. This is what's going on. This is what I think the diagnosis is. Of course, this isn't with the patient. They're doing this with me. They're not allowed legally to diagnose or anything like that, but they know their stuff as well as anyone, really. And so I really lean on my staff to help me stay on task, to do a lot of root canals, to do them successfully, and also to give the patient the perception of that I'm not in a hurry, that I'm not rushed. So even though we have a really busy practice, our workflow is such that the assistant can sit with the patient, can talk with the patient. We've got this pond that you can see with swans and ducks and geese, and they can just sit there and chat while I'm struggling with a case next door. And the patient has no idea that I'm like a little bit behind and trying to get over to them. So I think utilizing your staff, trusting them, giving them some autonomy is really beneficial. At least it has been for us at Wichita Endodontics. Any thoughts there, Erin, or ways you do things differently?
I certainly think the autonomy part, like I imagine these assistants feel very empowered and very important. And when you have that feeling, you show up for your job in a way that you wouldn't if you're just clocking in and clocking out and cleaning the break room and suctioning saliva. So I think the value of it is to you as a doctor, probably as much as a way to retain good staff.
Yeah.
I want to come work at Wichita Endodontics. I would say I will talk to you about that later. No. So we do things a little differently. My practice wasn't set up that way, and I don't know if there's different laws in California, and they have to have different degrees to do some of that stuff. My girls can certainly they obviously take all the X-rays and the CT scans, and they read them, and they can kind of triage for me. They know when it's going to have to go into a treat room, like you're going to have to open this up. She's swollen or she's got an active infection. They can read scans and CTs and X-rays, and they know when it's just something that I can just do a consult on and we can move on in our day. They do pulp testing for us. And again, that just sets us up for success of where to put them and then what to go from there. But when it comes to, a lot of the hands-on of the rubber dam, and I do all of that and explaining the CT scan and the diagnosis. And so we don't lean on them as heavily, but I honestly think Jake's way is probably a much more efficient, better way, not only for the doctor, but for the staff. So again, I do my way because that's just how we've done it for 45 years. And maybe California laws are kind of weird that way. But I think the more you can optimize your staff, the more efficient you will be, and probably the better quality staff and retention you're going to get. So I think there's levels to it.
Yeah, absolutely. And I love when we get reviews and the patient in the like Google review or something like mentions my assistant by name. Like I love that. They love it. They're just like, on cloud nine. So, and then it's kind of reaffirming that the assistant, I mean, the endodontists, we're only as good as our assistants, really. We
as your whole
cannot do it
staff.
alone.
Front
I don't
office.
even know. Yeah, I don't even know where anything is. I cannot find anything in the office. I'm like dead in the water without an
Nor
assistant.
could I take an X-ray. I don't know where the button is. I don't know how to do the whole, no. Turn it
Anyway,
on.
I know many of you residents are really looking forward to this because you're doing all right now. So
Yeah,
you're
they mix
almost
spices.
there.
Well, you don't have to mix sealer anymore, but
Yeah.
they do all kinds of fun stuff.
All right, for the next section, and this is really where the Avalon Biomed products come in and have really changed the way we've practiced. Erin and I use a lot of the same files and materials, and I think that's why the folks at Avalon wanted us to come on, because they've really made our days really efficient, really just really smooth. I'll kind of let you take it from here, Erin, kind of maybe talk about your files, your file
Sure.
sequence. Um, I won't repeat everything you said. I may interject a little bit and kind of tell you
Please.
how I do things, and we'll just kind of
Yeah.
go from there.
Okay. So he's right. The Avalon Biomed files and bioceramics really I've started using them about a year ago, so I'm a little new to them, but they have definitely changed my life for the better. I can't express to you how much I think these are part of this paradigm shift, this change in central dogma that's happening in endo that you guys are probably all learning, but us dinosaurs had to kind of embrace over the years. And I think without the CT scan and the laser or the gentle wave, these don't really work as well. So I think this is the fourth piece of the puzzle, but it is an amazing file system that embraces this minimally invasive endodontics, the idea to conserve the pericervical dentin, no need to make these giant glide paths anymore. You know, the files are efficient, they are flexible, they are reliable. I can get cases done so much faster. And Jake told me that when he told me about the files, and I was reluctant because I had my system, I had it nailed. I don't want to change anything. I'm fast. Nope, you're not. I can promise you these files will change your life. It is fantastic. It's the one I use is called Slim Shaper Pro, and I think that's your favorite too, right, Jake?
Yeah, yep.
Yeah.
I
So
use
if
it
you go
on
back
every
one
single
slide,
day.
sorry. So the path file is this the EV glider, which I love. If you like a path file, and I need it sometimes, this one is fantastic. It can take a beating, and it really can get you to length very quickly with reliable. I can trust it. So once I use the glider, if I need it, I'll go to the Slim Shaper Pros. It's a 3 pack system. It's a ZS1, ZS2, ZS3. I call them the 15, 20, 25 because I'm just simple minded and I don't want to remember those things. So when I need one for my assistant, I'll say, give me a 15. So, but they are so amazing. I get to working length. I'll put in the 50 ZS1, boom, it goes to length. Then the 20, then the 25, and you're done. Sometimes I'll use they have other file systems if you need more than a 25, which in reality you do at times. But consistently, I can finish a lot of cases, a lot of canals with just these 3 files. There's not a lot of in and out and cleaning the file and trying again. But it's to the length, to the length, to the length, cone fit, and I'm done. It
Yeah,
is cut. What don't you think?
so
Like 10 to
fast.
15 minutes off of your treatment times. I mean, I fit
Yeah,
in another patient or two a day easily now.
absolutely. And the matching gutta percha.
Oh, brilliant! I
Yeah.
don't even need to cut cones anymore. It goes to exactly where the file went, unless my reading's off. Fair enough, but
The
it goes where my file went, and so yeah, that saved me time too. Cutting it, maybe taking another X-ray or the Hail Mary of like, shit, I hope I cut enough, or was that too
yeah.
much? I don't need to do that anymore. And the sealer, we'll get to that, but the whole system, well, really, I told Jake I felt like I should send him a gift basket because I haven't tried it. You should, please. But anyway, the Slim Shaper Pros, I got off track. So I use those. And if I need to go a little bigger, like on a palatal or a big distal, I do what's called the apical shaper. So it's a 3% taper. So it's a small taper, but I can enlarge my apex to a 35. I usually do maybe a 35 or a 40. I rarely go to the 50 personally. I'm a little more into the idea of a sealer centric fill these days than I got a purchase centric fill. So I'm not, you only get 70% with your files anyway. I think that's right, Jake. And then the rest of it, you're using your irrigant. You're really getting in there with the laser or the gentle wave. And then I'm off to the races. I fill it, and I want more of this bioceramic sealer than I do of gutta percha now.
Absolutely.
So I don't know if you want to talk about your.
Yeah, I
Shaper.
think it's probably worthwhile to kind of go back to this page. I mean, I do this sequence here. This is really, I don't know if you can see my cursor, but this Blue Shaper Pro ZX, this is kind of like an orifice opener, similar to the
SS.
Pro Taper SX, Pro Taper Gold SX that we've used forever.
Mm.
And then the Z Glider Evo, it's some sort of path file to get you down to working length quickly. And then like Erin said, it's off to the races. It's 15, 20, 25, and you're obturating like almost all your cases at this point. If you need to go a little bit bigger, yes, but this pairs really well, as Erin mentioned, with advanced irrigation, in our case, the Edge Pro laser. because we're not so worried about touching all the dentinal walls, like over enlarging so that we can touch the walls, feel good about the way we're cleaning the canals. We're relying upon this fluid movement within the canals with the paired with the laser. I'll go back to this first slide on the Slim Shaper Pros. You may have already heard this, but I think it's worthwhile to repeat like why this is such a unique system, so different. I mean, really just
Yeah.
a game changer. So you'll
Yeah.
notice the different colors. So the color of, let's look at the cutting flutes in the file. So we've got the gold for the 15, and then this pinkish color for the 20, and then the blue, the 25 color. And so you'll see down here at the bottom, we've got the gold files. So these are more efficient at cutting than say a blue file, but they're less flexible. So this is all stuff that it's like right on, cutting edge. You're learning all the ins and outs of metallurgy in your programs right now. This is stuff that we learned. We don't remember all of it, but we know that the gold files cut well, but they're not as flexible. The blue ones don't cut as well, but they're more flexible. And so this system, we're incorporating three types of metallurgies to be able to create this hybrid system within one main Slim Shaper Pro package. And so when we're trying to get down to working length, we use that the Evo, we get down to working length, and then we really need that 15 to do some cutting. We need it to do its thing as it works down towards working length. And so you'll notice that on these Pro, and what makes it a Pro, because the Slim Shaper was the first iteration of the files, the Pros will have this, let's see, I think it's 3 millimeters of a gold tip. So this is, you can see right here in the center of the slide, the gold tip is enhanced by a thermal treatment for increased cutting efficiency. So it's not a different type of metal that's like glued on there. It's not going to come off or separate or anything like that.
Tip. Yeah.
It's heated differently. It's treated differently. And so you have kind of this, I call it a power tip. It's this pro tip, the gold tip. And so you're getting a lot of cutting efficiency with that 3 millimeters a tip, which you need. But that tip's not going to be as flexible. You can see it here. The tip's not going to be as flexible, but we really don't need a lot of flexibility in the tip. We need the flexibility in the center of the canal, like in the middle of the canal, across that greater curvature of the root canal system. And so once we've got our 15, our ZS1 down to working length, we can back off on the cutting efficiency and we can increase the flexibility. So as the diameter of the file is getting larger, the cutting efficiency is going down a little bit throughout the length of the file, but we still have this power tip. We still have the pro tip that is doing work and making sure we maintain this patency and access down to the working length. So I think it's
Jake,
just...
don't you think you can feel that when you're using them?
You can.
I can feel it. I mean, the ZS1 is powerful. It can cut. It gets there.
I mean,
and then
2 years ago, I started using the Slim Shaper files that didn't have the pro tip, and I love them right away. But as soon as I tried the pro, I'm like, okay, this is...
It changed everything.
Yeah.
That tip is, like you said, it's magic.
Yeah.
It's great.
So if you haven't used them, you've got a great opportunity at AAE to check them out, to try them out, to hopefully,
I
get...
highly recommend you try these.
Yeah, for sure. I was using the Edge Endo X7 before, which is a similar shape. And you were too. I know a lot of guys use that. They're not bad files, but I love the Slim Shapers. I like the X7s. I love the Slim Shaper Pros.
And I think the Slim Shapers are certainly getting faster than the Edge. I mean, for sure. But I used to use a lot more Edge. Like I would see them unwind and I'd have to check them and then do it again. These don't unwind on me. I can use them a couple of times at least. And I don't find they unwind like the Edge did.
No.
More importantly, I feel like, and this is the whole point of it, right, Jake? Like your root canals they have that natural anatomy curve to them. And I feel like the Edge Pro kind of manhandled it a little. Like it just looked a little less anatomic. And now it really has that. You can see that it really is following the curvature. It's really respecting the canals. I mean, look at Jake's cases. They're beautiful. And I don't think you could get that, in my opinion, like finesse that just 5% better finesse that you get from these files and the way it looks means everything at our level.
Yeah, for sure. And I mean, love it or hate it, the referring dentist wants to see a beautiful X-ray. That's what they want. They're not going to know how well you cleaned it, if you used the laser, if you didn't use
Right.
the laser, how many seconds you use bleach. They
Yeah.
don't see any of that. They look at the X-ray, for better or worse. And so I have a couple cases on here that I feel like really show off the benefit of the anatomy. We've got this like limited maximum flute diameter. We have a nice continuous taper. We have just kind of this really great appearance, in my opinion, of how root canals can look when we keep them conservative.
Yes.
And here's a few premolars with three roots that I did not too long ago. And again, the same thing. You just see like these really nice shapes to them. And they were all done with the Avalon Slim Shaper Pros and then the Avalon Neo Sealer Flow and the Neo Sealer Flow Easy sealer. So anything
Yeah.
else, Aaron, before we move on to the sealer products? I think we
No,
got some
no.
cases here too. Here we
Um,
go.
oh yeah, just a few. Same thing. I just showed you a few. Just I mean, it just looks more natural, and it looks like you're following the anatomy of it more than I would get from my other files. But it's still not super skinny. It's still the little white lines that the dentists want to see. I still feel really confident that everything was cleaned and is done well. I just think it is a higher level file like I've never seen before. And it's faster. I mean, it just
Yeah.
it just seems to have it all. But like you said, what we need to talk about is the gutta percha and the easy flow sealer because those together with the file, it's magic. It's fabulous.
I think we may need to go through these quickly just to respect everyone's
Oh
time.
yes,
We're
sorry.
getting up to
Oh,
the kind of the
sorry.
end of the
Yeah.
webinar tonight. I'll just kind of mention the Neo Sealer Flow, it's been around for a lot of years. I started using this 2.5 years ago. I was using the Brasseler BC Sealer before, which I liked. I didn't have really any qualms about it. But I started using the Neo Sealer Flow for a couple of reasons. The main reason was price. It was significantly less expensive. So it was kind of something we were looking for in our practice because we're using this on every single case. There are 6 of us in our practice. So we're going through a ton of this stuff. And then the other thing too is I felt like when I tried this out that it behaved better under heat. So if I was down packing, searing off at the
Sure.
canal, the larger canals where I wanted to kind of do some down packing, some heating and down packing of the gutta
Yeah.
percha. I didn't get that kind of like heated, smoking, crumbly type stuff that I was getting with the Brasseler product. So that was kind of the main reason that got me to switch. So the price and then the performance under the heat and the pressure. And then I guess it was about a year ago, maybe I got my timing off, but Avalon Biomed introduced this Neo Sealer Easy Flow. And it really took a great product and made it even better. Kind of like the same jump from the Slim Shaper to the Slim Shaper Pro. So we have the
Yeah.
Neo Sealer and then the Neo Sealer Easy Flow. And so the big differentiating factor between the two sealers is the way the Easy Flow is designed is that it's thin enough to where it can consistently, without clogging, pass through these Navi tips. These are these ultra dent Navi tips. The tips come with the sealer that we buy direct from Avalon Biomed, and so you can get this thin file that's durable. It's not that flimsy,
Yes.
rubbery, whatever, that wastes a lot of the product. This is conservative. You can do a bend in it if you want, and
Yes, you can bend it.
you can
The tip is brilliant.
yeah, you can see around it and you can see the sealer flowing into the canals and it just works wonderfully. It there's
Don't
kind
you
of
think you
here
can get
that
it down pretty far? I mean, I can get it half the route
yeah,
easily,
yeah, or
or
beyond. I mean,
within 3 millimeters of the apex, depending on your tooth. I mean,
yeah.
it's
I
fantastic.
feel like I can see so well. I don't use the rubber stopper that often, but you can
Yeah.
measure it and make sure you're getting it to the spot that you need it to get to. And
Right.
then there have been some studies that have been done. Here's some comparisons done with the BC Sealer High Flow and the BioC Sealer Ion. And you can see that the Neo Sealer Easy Flow, it kind of maintains its texture and consistency even when applying heat. So if you haven't tried it, get it in your hands,
Yes.
talk to your program directors. I've got a couple cases here that, Erin, why don't you show your cases of some healing with this sealer and
Oh,
then I'll
sure.
show some
So
of the
just to
flow.
kind of threw it in quickly, I just think the bioceramics have a lot to offer with the calcium hydroxide precipitate and then it just the antibacterial properties. It has, I personally recall all my cases at 3 months, 6 months, and 1 year, anything with a lesion. And I've been seeing them healing at 3 months what I used to see at 6 months. So I just sent them this case. This has only been 3 months since I did it, and so you can just see in the two CT scans, the bottom scan there is 3 months later, and how much bone I've gotten back from the osseous regeneration. So I'm just thrilled. I think, like Jake said, it doesn't get weird under heat. It doesn't get sandy and gritty, and the with the gutta percha, which kind of cuts like butter, like soft butter. It's so perfect. It doesn't get gooey either. So you just sear it off and pack it, and nothing changes. It gets goopy or weird. The sealer and the gutta percha together are a really great product, and you get such consistent results. And Jake, I think, has some really cool cases where you can actually see how great the easy flow. Yeah, I mean, it really does happen in a lot of cases. You
Yeah,
can
so
see getting
these,
into
I
all those
mean,
spots.
yeah, lateral lesions, lesions that you might expect to have to do apical surgery on.
Yeah,
I'm waiting on follow-ups on these because they're not super old, but yeah, the sealer just it flows and it heals and the bone heals
yeah,
around it and just yeah, some wonderful results that we're seeing.
yeah.
I think we're going to talk just a little bit more about a new product. Aaron and I have used this kind of in some testing in patients. So this is a type of sealer remover. So it's a bioceramic sealer remover. It is called NeoSolve. It's going to be launched at AAE next week, and it's designed to do retreatments when bioceramic sealer was used in the first treatment. So I know, at least when I was a resident, one of the big concerns, like bioceramics, were just kind of like starting to become more popular, and we were going away from, resin sealers and different types of sealers. And one of the concerns was, am I going to be able to retreat
Yes.
the bioceramic cases?
How do I get that
So
cement out of there? Yeah.
yeah, traditionally, at least what we've done is we've had to when it's a case we know has bioceramic sealer, sometimes we don't always know. Sometimes we have to kind of look for clues while we're working, or it may be a case that I did and I know what sealer I used in the case because I have it recorded in the patient's chart. But traditionally, we've had to over enlarge. So we have this, nice conservative shape, but in an effort to kind of remove the sealer, we enlarge maybe larger than we would like to in an effort to remove the sealer that's still stuck to the dentinal walls within the root canal system. And so in my testing on this, I've used it on a bunch of cases. Um, what you can see is so you do whatever technique you use to remove, if you use chloroform solvent or whatever you use to remove gutta percha, you still do that the old way. And then instead of over enlarging the canal, then you switch to the NeoSolve and you're flushing that. And what you'll see is that this kind of clear solution will turn kind of a milky color as it's dissolving the sealer that's set within the canals. And then under the microscope, in conjunction with the laser assisted
Yeah.
irrigation, I feel like we're getting cleaner canals.
I was going to ask you that. You use it with the laser, right? You
Yeah,
irrigate. Yeah,
yeah.
me too.
Mhm.
I
Me
think it
too.
made a big difference. Yeah.
Yeah. So really exciting product. Again, talk to your program directors, get it in your programs, get your hands on it. Come check it out at the booth next week. We'd love to kind of show you how we think it's going to be beneficial in your root canal retreatment cases. We have other stuff. I think we're going to skip that and get to the questions. If there are any questions, and then we'll kind of wrap it up. So, Allison?
Yes, yes. Awesome job. Thank you all so, so much. So we do have a couple of questions. One was, what brand of CBCT have you used and what kind would you recommend getting?
Go ahead, Erin.
Yeah. So we've traditionally always had a care stream. And we've updated it over the years. I really like it. I think it works well. We have the latest version of the care stream. So I can only speak to that, but it's been a consistent, great CT scan. They keep coming up with bigger and better ones. So we've updated it maybe 3 or 4 times in the last 15 years.
And our machine is the Sirona. Is that what it's called?
probably.
Yeah. So you can see how much I lean on my assistants. I don't even know how to run the machine, honestly.
Oh, no.
Calibrated, they line up the patient.
Yes.
I use it not because it's the best, although it might be, I have no idea, but because it's consistent, it works well. I can see what I need to see. The images are clear. I don't
Yeah.
have a good comparison, so I wish I could be a better help there, but
Yeah.
yeah, I know there's some that are better than others, but we've got really great consistent results with the Sirona.
Yeah. Same.
Well,
Carestream seems really great. So
I will say too, Dr. Bruno Acevedo would be a good person to ask questions
yeah.
about CBCT as well, if
Yeah,
y'all. I
the
know
cone
he
beam guy.
loves to chat, so cone
Yeah.
beam guy, yes, for
And
sure.
I'm sure he will be at AAE. He loves to chat and share his knowledge. So find him, look him up on Instagram. I think he's probably got a website. He was a resident. Did he finish? I don't know if he
He's
finished.
done. Yeah, he
He's
finished at
done. So
Einstein. Yep, he's in Austin now.
yeah, for sure. What else?
At what point in the case are you using a laser? Do you use it on every case?
Yeah, so I like to say, Erin kind of touched on this a little bit. I like to say use it early, use it often. Our biggest challenge with using it on every case is we're sharing it between two doctors. So we've got 6 doctors, so we have multiple units, but we're sharing it back and forth. And so some cases I know I need it throughout the entire procedure. Others I'll use it only at the end. But preferably, I like to use it as soon as I enter the canal. There's a shorter tip. I call it tip 3. I think that's probably what it's
Yeah.
called. It's kind of
Agree.
shorter and thicker. You use it with higher power. I'd love to share my settings with you. I don't have them memorized. Again, my assistants have it set, so I just go, 1, 2, 3 or whatever. But I can send those to you if you want to reach out on Instagram because I use different settings for tip 3 versus the tip that enters into the canal. But especially on the necrotic cases, I love accessing, and then you just kind of get that gunk, the goop that's in the canal that's blocking everything. I just fire it with water for 30 seconds, and it's just like, oh, there the canals are. Let me just, you know,
Right.
let me put the ZS1 in the canal, and it's like you said, off to the races. So use it as early as you can in the procedure. Use it often. I think you'll notice that your cases turn out better and you're faster with it. Really, it doesn't slow you down; it speeds you up.
Yep, I'm the same. I use the fat 3 when I need to. I always use a 1. I actually go into the canals at the end, and do a really thorough laser. It probably takes me maybe 2 minutes to actually do it. And I'll use it throughout if I need to. And Jake's right, we have to share, but it tends to not be an issue so much. I mean, you do what you have to do, but use it often and use it on every patient. It is so worth it. And it's so easy and it's fast. And I can share my settings. Yeah, I can share my protocols and exactly how I do it. I know we're running out of time, so just get a hold of us on Instagram and we'll walk you through that.
And then I know y'all are both using Edge Pro laser, correct?
Yeah.
Yes.
That was a question. And then why rely more so on sealer versus gutta percha?
Yeah. So, well, Erin, maybe you take this
Oh, go
since you're the
ahead.
one to mention it, and then I'll give my
Oh,
opinion.
okay. Well, so like Jake said, what we won't want to do is really brush all the walls. You're not trying to enlarge anything anymore. You're just trying to get the debris and the tissue and all the smudge out of there. And the laser does a lot of that for you along with the file system. And so what you really want now is all of these properties of the bioceramics that we're seeing with the hydroxyapatite formation. It precipitates calcium hydroxide. It actually interacts with the ions, the calcium and the phosphorus ions in the body. And then once it's in there, it actually will precipitate calcium hydroxide for 1 to 3 months inside. And so you want all of that in there. You don't want gutta percha all over your walls. You want bioceramic sealer all over your walls, all into your lateral canals, because that's antibacterial. It's alkaline. It's going to kill those bugs. It leaves calcium hydroxide in there. And then it precipitates into hydroxyapatite into the hard tissue. So for me, that's the more of the goal. And then you can preserve all that natural anatomy. So you're not gutting this tooth anymore, but you're cleaning it thoroughly. And the bioceramic sealer is really the medicine. The gutta percha is just a filler, right? Perfect. We don't need a filler anymore.
Yeah. Yeah. I mean, I think you said it perfectly, really. I mean, honestly, if we could consistently fill everything with only sealer, I would do
yes.
it. And maybe this NeoSolve will change that, but really the purpose of the gutta percha is so we have a pathway back down to working length when we're trying to retreat it if we need to get that, or
And
to kind of
sometimes the
spread the
comb can kind
shear
of
out.
pump,
Yeah,
don't you think you pump and then it'll
pushes.
squish all
Yeah,
that bioceramic to where you want
yeah,
it to? Like, yeah, but most if you could just do it with bioceramics somehow, that would be the key.
yeah, for sure.
Yeah. I hope that
But,
answered the question.
you're on mute, Allison.
Sorry.
Thank you.
Mhm.
Any hand filing, like a 10 file before introducing your rotary files?
No. Erin does. I don't. I estimate the working length off of the CBCT. We can usually get it pretty dang close. And
Yep.
so I'm confidently going to working length with my Evo glider file or my ZS115 file. If I'm really concerned about anatomy, like I don't want to be a millimeter long because of the IAN or mental foramen or sinus or something like that, then I'll purposefully go a little bit short and then use a hand file for working length just to measure. But I'm not hand filing hardly ever. I'm using the hand file to measure working length.
Oh yeah, sorry, that's what I meant. I don't actually
Yeah.
hand file. I just use it to get a working length. So I'll open it up with the orifice opener, and then I usually can get right to a working length. We estimate it too. I still use the Root CX and just like to hear that beep 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 of my estimated lengths, and then glider. So it's like I use probably an 8 or a 10 in each canal once, if that, just to get the working length. But I'm not actually hand filing as far
Yeah.
as cleaning.
And then for calcified canals, how I do it, I mean, there are lots of different ways to do it because, I mean, you might say, well, you got to hand file a calcified canal. And honestly, you don't really have
Um,
to with
Not with lasers and not with
the
these
laser.
files.
Yeah, with the laser and the modern files. And so sometimes I will use a C file, but I'll just kind of alternate. So I'll use like the Evo Glider file, and then
Yeah.
I'll maybe get my 10C file to bind and pull it out, and then I'll run the laser with tip 3. And I'll just kind of go through that sequence a few times until I'm down to working length. But I think you'll be surprised when you incorporate the laser and the modern files with the cutting tips, how well you can work through calcified canals. One of the problems with hand filing, in my experience, is it takes forever, and you get transported canals. Sometimes
Yes.
you don't ever get to end of working length. Like if I can avoid using a C file in a canal,
Yes.
I have a much better chance of getting to working length.
Jake, that's excellent. Exactly. I forgot about that. I mean, that's why we stopped doing that so much. I mean, if I can't get to working length, then I'll work it a little bit and I'll do what he does. I'll go with the EV glider and go back and forth. But I want to do as little manipulation in that canal as possible with those clunky hand files because you're going to mess it up. You're going to transport something. It's not necessary. Um,
Yeah,
but you also don't want to force anything down there until you get to working length, in my
sure.
opinion. So I like to be able to get to working length.
And
But
again,
with
I
the
mean,
laser and the glider, it's no problem.
and this is probably a lot different than you're getting, I mean, in residency, but I mean, I'm happy to talk you through things next week if you want in person. We can talk about, strategies and techniques. And I mean,
Yeah.
it takes time to learn the
Hey,
skills. It takes
please don't
time, but
hesitate to call
you'll
us
get
or reach
there.
out. Yeah.
Yeah.
There's just a couple questions left. One, can y'all go back to your Instagram so they can see that
Oh,
while I ask this other question?
yeah, it's on this side, it looks like.
Yeah.
And then
So I think this picture was at the resident. This young man won a computer, right?
Yep. Specialty one
Yeah,
can throw a
specialty one
party. So
party.
I would highly recommend you come hang out with us just to have some good
Yeah,
time.
and then I think this is when we were giving out, for those that are presenting, we gave out
Oh
some
yeah.
sort of scholarship or something. I don't remember. It
Got
was a $500
$500
to
for
travel. Yeah,
their travel costs or
yeah.
something.
So anyway, but yeah,
Cool.
you can see the Instagrams there. What was the other question, Allison?
how many cases a day for each of y'all?
I like to do 8 to 10.
That's exactly what I do. 8 to 10. 8 for sure, 4 in the morning, 4 in the afternoon. And I can usually get one at lunch, in for an emergency, in there somewhere. And then I wiggle one in somewhere along the way if I need to.
Yeah.
Or sometimes depending on what they are, the schedule just can fit 10.
I used to like block out more time for more complicated cases and things like that. I'd have like 5 or 6 units here and four. I do 4 units for everything now, and then I just, I usually have extra time just
Yeah.
because of the way we're doing things. So,
Right.
the root canal might take 10 minutes or 20 minutes when
Yeah.
it used to take 60 or something like that.
Right. And I
So
have consults at the top of every hour. Do you do that too? Like a consult, a
we
training
we kind
consult?
of have we have two columns of consults, and we have assistants that are just consult assistants. So we're just kind of like
Oh,
doing
that's
those
right. So
in
efficient.
between.
Yeah.
Yeah. So my day looks like I start my first patient's at 7:30, my last one's at 2:30. And so I'm usually home by 3:30 or so in the afternoon, which is really great. My kids have activities and games and matches and dance and things like that. So I like to work out in the morning and go to kids stuff in the evening. So it's really great. It's a great life.
It's a great life.
Yeah.
Last one. After injecting sealer into the canal, are you also coating the cone when you obturate?
I do
No.
not.
Yeah.
I think one of our partners does that. I'm not sure what the reasoning is, but again, I'm like Erin. I want to use the gutta percha cone to push the sealer
Yes.
in 3 dimensions and make sure I get a good 3 dimensional fill that's mostly sealer.
Yeah. I mean, I'm filling up that whole canal with sealer. I mean,
Yeah.
it is a soup,
Mhm.
sealer soup.
Yep.
Then goes in the gutta percha. Yeah. Although I don't think it would hurt to coat the cone. I mean, go
No,
for it.
no.
Another last question. Looking from a debt perspective, how many cases were you guys doing straight from residency, and how much did you make your first year?
Let's see. So we actually just had a new resident start in August, and he started doing 4 cases a day right from the start. So we have some pretty good systems in place with well-trained assistants, and we were like ready to hit the ground running when he came. And so he was I think he was pretty intimidated at the start, like thinking he used to do, I think, two in residency, one in the morning, one in the afternoon, and maybe in a couple of visits. But we ramped him up quickly. As far as money, I mean, maybe triple what I was making as a general dentist. Like, I don't know, hundreds of thousands.
Right.
Yeah,
Uh,
it's good money. It's good
it's good
money.
money. I mean, this was for me, it was 18 years ago. So I'm going to try to remember, but I'm pretty sure it was 4 cases a day, like two in the morning and two in the afternoon, like Jake said, and that felt overwhelming at first. But this is where, like Jake did for his associate, my guys just, man, that mentorship, that help, that they would step in and help me find the canals I couldn't, and I could see what they were doing and what they were using to do it. And then we talk about it later. And that got me fast. And before I knew it, it was 6 cases a day. And then now it's 8 cases a day. And I could probably, like Jake, do a lot more. It's just nice to sit and have a cup of coffee while I wait for the rest of that appointment time to pass. And I
Mhm.
do my notes because we're finishing a little faster.
Mhm.
Um, yeah, I made, I mean, this was again a long time ago. So it felt like a lot of money back then. And it is a lot of money, but it was hundreds of thousands of, I mean, it was like, I think $400,000 was what I made my first year
Yeah.
out, but I live in California, so I wasn't rich by any means. But I could support my family, and I love what I did, and it just goes up from there.
And let me just mention on the debt thing, I know that that's a
Yeah,
big concern, especially even more so now than, I mean, it was a big concern with my generation of endodontists, and it's even more of a concern now because of the price of everything. But d- try not to try not to let it weigh on you. I mean,
yeah,
that would be my advice. It's there. I shouldn't say we all have it, but most of us
yeah,
have the debt from school. But really, it was the means to get to become an endodontist, which is just wonderful. And
yeah,
so I know that you look at the number and it's a big number and you're like, well, it's going to be a high monthly payment, but you're going to be able to do it, and you're going to be able to go on vacation, and you're going to be able to buy a house and do all
right,
the things that you want to do. So I wouldn't stress too much about it. Try and pay it off when you can. Try and get the best deal to make as much money as you can, but
yeah,
don't do that at the expense of enjoyment. I mean, don't postpone. Like I feel like my biggest advice would be like, don't kick that down the road, like enjoying life and doing the things that you wanted to do. I mean, the reason why you've worked so hard to get to this point is so that you can have the life that you want to live. And
mhm,
so, life is precious, it's fragile, and it's short. And so my advice would be to get graduated from your residency and start making money and just start enjoying, not that you're not enjoying life right now, but it's different. Enjoy the fruits of your labor and you'll pay off the debt. You will.
Yeah. Oh, that's such good advice, Jake. I agree. I mean, I think my financial guy said I'm going to pay him off when I'm 60. I'm like, great. I
Yeah.
mean, I don't care. It's not inhibiting anything. I don't ever not get to do something because I have to pay that student debt monthly. I don't even know what it is. It's just
Yeah.
auto pays, and I don't
Yeah,
even know.
same,
To be
same.
honest with you, I have no idea
I
how
don't
much
know
I
what the
pay.
number is. I
Don't
don't
ask
care what the
me. I have
number
no
is.
idea.
Yep.
But I know that it doesn't get in my way. And I think this comes back to just set yourself up for success. Take your time, find the right spot, get good at what you do, and the money will come. Don't be in a rush to do 6 to 8 cases a day and set yourself up for feeling like you're not a great endodontist. Get really good at what you do, and you will make plenty of money. You will be fine, and you'll love what you do that way. So just take your time, find a good space, and work on your skill.
Yeah.
And
And
don't worry
it's
about the
going
money
to
and
be
enjoy your life.
it's going to be hard at first. Like even if you're doing 4 cases a day, it's going to be hard. You're going to break files. You're going to perf teeth. You're going to need to repair stuff. You're going to have conversations you don't like to have with patients and dentists. Like I did this, I didn't mean to. You're going to have some nights where you kick yourself and you don't sleep much. That happened to all of us. And
Yes.
so don't beat yourself up because you feel like you suck at the beginning. We all sucked at the beginning.
So true. And
Yeah.
like I said, I think it takes 3 to 5 years to be really like, oh, I got this. But every day, every year is better. So just stick to it, keep getting out of bed and doing it, and you're going to do great.
Awesome. Thank you all so much for joining us. I hope you all took home some good nuggets from Dr. Duarte and Dr. Butler. So thank you guys again both so much for joining us. Lastly, if y'all will be at AAE next week, please come by and say hello. We will all be there. Come by booth 1511. And for staying on the duration of the call, you guys do have a chance to spin the wheel for free. So otherwise you'd spend $99 to get to spin the wheel. But for attending, you get to spin the wheel for free. You have a chance to win some free product or cash. So please come by and say hello. We'd love to see y'all. And then also I wanted to mention if anyone was interested in doing the CBCT course with Bruno, I know he is doing one in in April in Austin at the end of April. So if y'all have questions about that, reach out to me. I'd be happy to share it with you.
That would be a good one.
Yes, absolutely. Well, thank you all so much and have a wonderful rest of your week and hope to see y'all next week in Boston.